Increasing success stories for people affected by breast cancer relies on a unique combination of elements: access to information, preventative screenings, early detection, and treatment.
Early detection is one of the most important factors in treating breast cancer because breast cancer is a very predictable disease in terms of spread. So the faster we find breast cancer, the earlier we find it, the less invasive your interventions are going to be, the less long-term impact they're going to have. So if I can find a breast cancer while it's still what we call in situ, which means still sitting in the duct where it's originally formed, I can take that section out. If it is spreading to local lymph nodes, then we're talking about taking an entire breast, possibly lymphatic chains, chemotherapy, radiation. Things get more and more invasive the longer that you spend kind of letting that cancer spread. And so the faster we get it, the better it is for your patient, the more treatable, the better our survival rates are, and the better our rates are of people not having long-term complications from those treatments.
There's the issues of screening that you can educate the community about, and that can be done in a variety of locations, stores or churches, other community organizations, to help get the word out about the risk of breast cancer and what women need to do in order to help prevent that from occurring, or if it occurs, to catch it relatively early and soon to do something about it.
By focusing on women's healthcare in particular, healthcare providers have made great strides. When caught early, breast cancer is one of the most treatable cancers today.
Specifically with breast cancer, I think screening is a big issue. A lot of hospitals, our hospital included, offers free screenings, but getting the screenings and then the next step to get any diagnostic care done often creates a barrier for patients who are uninsured or underinsured, which is often the case. Transportation is a big issue in rural communities just because we don't have Uber, we don't have taxis, we don't have a public transportation system.
Seek information and for an individual to be able to get answers very quickly that are concise and can be helpful in their stage where they are in life. It could be that they're a young mother, or they are a older woman who's more towards the end of her life versus someone who's still much more active. So by making sure there's good access to information to the general population that people can reach out to and obtain that information.
Healthcare providers deliver quality, best practice treatments to rural and urban settings alike, ensuring consistent improvements and advancements in women's health. In 1922, Decatur County Memorial Hospital opened its doors to the community it serves. Today, DCMH operates as a critical not-for-profit facility and critical access hospital, dedicated to the health and wellness needs of patients, community, and staff.
So Decatur County Memorial Hospital has a unique situation because we are in a rural watershed. We're in between two major metropolitan areas. That gives us the ability to access big city medicine, but because of our partnerships with those communities, we're able to bring it here to the hospital. That gives us an advantage when we're looking at women's health care, because women are traditionally taking care of all of the family caring duties as well as taking care of their own health. So when we can bring things to them, it allows them to take care of their needs, get the screening and the care that they need in a place that's close to home and that's familiar with them.
When I got diagnosed, everything happened very quickly. It didn't take very long for me to have my part surgery. I already had PT calling me about some exercises I'll have to do after my surgery. So I feel like they just moved me really quickly through the process. Matter of fact, it was a little bit overwhelming just because so many phone calls coming in and all these different doctors. But I feel like I know some people that go to bigger hospitals and it takes them a while to get in and be seen. And I feel like here I got seen really quick.
Decatur County Memorial Hospital has the unique ability to utilize funds raised by the DCMH Foundation's Pink Ribbon Fund and Cancer Care Fund. DCMH is putting these resources to work, seeking to improve education, access to care, and treatment options for those who need it most.
Someone who's undergoing treatment for breast cancer is going to experience a lot of inconveniences. It is a disruption emotionally because we, as human beings, feel like we ought to be able to trust our bodies. They get us up in the morning, they take us places, they let us do things. And to suddenly discover that something has gone wrong and part of your body is actively trying to kill you is a huge emotional blow. That plays into every aspect of life.
You know what, I had cancer and I got through it. So seeing those faces, and you may not know how important this is or how close to home it is until you realize that your teacher or your bus driver or the lady that works at Wendy's had breast cancer and they survived it and they've thrived with it.
Contact Decatur County Memorial Hospital Radiology today at 812-663-1157.